brothers and sisters, as I said, we welcome you tonight to this Hidden Science Meets Hidden Truth, the secret science of sickle cell. And I'm not really going to be taking up any time in truth. I will be offering you the ability to ask questions. We've got our first speaker lined up, Samantha Greaves. We call her Warrior Queen. This sister does not play. She's an absolute stalwart in our community. Love the sister. She's always on the front line of liberation and salvation of the Black community. So brothers and sisters, as our sister is doing I think she's got 20-minute presentation. After the 20 minutes, we will be opening the doors for direct questions. Please, brothers and sisters, put your hand up and you'll be allowed to ask a question. We'll unmute your mic. Pardon me, and you better ask your question. Now, just before I bring the sister on, normally we have quite a number of questions. So to help us try and get as many questions done tonight as possible, so everyone has a fair chance to ask a question, please, when you come on, can you really direct your question and make it as succinct as possible, where the presenter can answer. And again, I'll say to all the presenters, if you can answer as succinct as possible, so we can then move on to the next person, and that will allow as many people to appreciate that they've had a chance to ask a question. Okay, brothers and sisters, so it's pure love. Samantha Greaves is someone who's been on my show as well regarding sickle cell, and she blew the platform apart, and she's in the who's who around the world when it comes to this subject. So Samantha Greaves, can we see you, my queen? Can we hear you, my queen? Oh, there's our beautiful sister.
Oh, well, thank you for such a great welcome. You know, it's always a pleasure, always an honor.
All yours, my queen.
Yeah. Brother Dion, Hidden Science family, Hidden Truth family, it's always a pleasure to be on these platforms. I'm at home and I feel great. All right. I'm just going to share my screen. Takes me a while.
Take your time, sister. We're with you there.
Okay. I would just like to say before I start, welcome everybody. Hi, it's really great to see so many people on the platform. It's sort of kind of overwhelming as well. I'd like to let it be known that I am speaking as a sickle cell warrior, not as a health professional, you know, and also as somebody, an advocate for my sickle cell peers. You know, so I'm not speaking from a medical point of view. I'm a grassroots community, you know, person, and that is the stance that I'm coming from. So the information that I share is information from a personal point of view and that of my peers and the works that we do within our community. Okay, right, so it's going to take me about 20 minutes or so, so I'll make a start because it's quite congested. I try to get as much information in as possible. Okay, so I'm a natural health and personal wealth encourager. I like to encourage those things. I'm going to actually turn off my camera because it's actually getting on my nerves. It's taking up space. Right, so I'm the co-founder of Hasif Promotions and Healthy Living International Limited. Just to give you guys a bit of background of me, I'm the administration manager for the Two Real Stop the Silence Global Network, and I'm the team training coordinator for the Gift Genius African Heritage Wealth Empowerment Program, and that helps us to raise money like in the Gambia to help our sickle cell warriors. I started writing my book. I've not got very far. It's another project. I started writing it in November 2018 on the shores of the Gambian Sea. I hope to get it finished this year. And I am also the founder and the group coordinator of the Sickle Cell Care Advocacy Unity Support with Empathy Group, otherwise known as Sickle Cell Cause. My name is Samantha Greaves, also known as Warrior Queen in the community. I am a mother, a grandmother, and I've been a community volunteer since 2017. Right, so the patients, the sickle cell warriors that I work with from Sickle Cell Cause are under the medical, you know, assistance. They're treated under the hematology department of the North Middlesex Hospital Trust, which is in Edmonton, North London. And we always celebrate the days, the 19th of June, which is World Sickle Cell Awareness Day. I thought I'd just throw that out there. And also the month of September, which is World Sickle Cell Awareness Month. And because it is World Black History Month, you know, throughout February, I'm going to chuck in a bit of history because I always mention Dr. Neville Roy Clare, who was also my mentor, but he was also the first person. He's a sickle cell warrior. Sadly, he passed in 2015, but he was the person that created the first sickle cell organization in the UK and Europe. So his organization, the Organization of Sickle Cell Anemia Research, was founded in 1975. As a sickle cell warrior, he done research and went to like medical professionals and went to America and Jamaica and done a lot of research. He's even written a book. So he is the he wrote the black print of what sickle cell community support and research is in the UK and Europe. And Oscar, that's their logo. It still stands today. Each and every year since 2015, we celebrate Neville's name. We always like to remember his name, because if we don't remember our own, who will? You know, and we give an Oscar trophy to those in our community that done something above and beyond to help the sickle cell community in any way possible. The first Oscar was given to Curtis Augustus Stewart. He was the first chairperson of this organization, Sickle Cell Cause. Sadly, he passed in 2017. And I would just like to say that Supreme, DJ Supreme, he also received his Oscar trophy on that same day. You know, so not many people have a trophy, but we only give it out to people that do over and above for the sickle cell community. And it's given out by Neville's wife and daughter, and we remember him with honor. All right, so we do a lot of programs in our organization. We support the Gambia. We work with advocacy, you know, we're campaigning to keep our purpose-built center. We campaign for correct housing conditions and for all medical staff to be sickle cell trained, because not every medical professional that is practicing has any sickle cell awareness or sickle cell training. And sometimes a sickle cell warrior is faced with that medical professional when they're in full-blown sickle cell crisis, and it's not a pretty sight. You know, it's something, it can take lives, and it's something that we're campaigning to make change for. We heard that over the last 18 months, they are looking into it, and they say they're working on it. So we think that our voice is being heard. We do workshops every month, obviously, like during this season, we can only do them online, which is like volunteers workshop. We do a lot of therapeutic and holistic healthcare workshops, as you can see written there. Also employment advice, surgery, food and social outings, you know, and events. And we also do awareness programs in schools, in hospitals, anywhere that we're asked to go, we go, and we do awareness programs, mainly on social media in these days. As I said, we're fighting to keep our center. Our center was built for us in 1987, and it was officially opened in 89. It's called the George Marsh Sickle Cell and Thalassemia Center. We believe that we've won the rights to use it, but because of the pandemic, we can't use it because we've all been told to isolate, self-isolate, because we are now vulnerable people. Before we're not registered across the board as being having a disability. That's the reason why we have to have so much advocacy and fight so hard for everything, because every sickle cell person is different, and because they don't recognize sickle cell across the board as a real disability, it's very strange that now all of a sudden we're all vulnerable, you know, but they still haven't said that across the board sickle cell is a disability. So I did notice that there was a question in the chat room a bit earlier asking why medication can't be free for sickle cell patients across the board. Well, it would never be free for us until they recognize sickle cell as a complete disability, and that would, you know, answer your question. That proves that it is not recognized across the board as a disability. So we're fighting for our center. If we believe we've won the rights to use it, but we'll find out after the pandemic. But the question is really, what is sickle cell? I'm just gonna try to hide this panel. That's it. Right, so sickle cell is an anemia, and there are many types of anemias out there. The more common known are like general anemia, thalassemia, leukemia, hypoglycemia, and the most common and the fastest growing worldwide is sickle cell anemia. Right, sickle cell anemia is known to affect mainly people of African, Caribbean, Middle Eastern, Eastern Mediterranean, and Asian origin. Right, I have to stress at this point that people like to say, oh, it's a black man's disease or a black man's illness. It is not. It's sickle cell doesn't matter. It's a blood condition. The melanin in your skin doesn't create sickle cell. It doesn't affect sickle cell in any way. You know, it is because the reason why it's in these areas is because of mosquitoes and malaria. You know, so that's the reason why it's more predominant in the black community rather than anywhere else. Right, it is a serious, inherited, excruciatingly painful blood disorder with over 100 recorded types, with 7 in number being amongst the most common. The issue is that the red blood cells, which carry oxygen around the body, develop abnormally, causing the extreme deprivation of iron fluorine, which can cause over 20 other diseases and conditions to manifest. So you will find that somebody with sickle cell doesn't just have sickle cell, they usually have other conditions and illnesses as well, like gallstones, jaundice, you know, gallbladder problems. There's other issues as well. Right, to have the sickle cell anemia, you will have inherited the defective gene from both parents. If you only inherit the gene from one parent, you have what's known as the sickle cell trait. It's likely that you will carry some sickle cells, but you'll be able to produce normal hemoglobin as well, and won't usually experience severe symptoms. However, you'll be a carrier of the sickle cell anemia, and you may pass the abnormal gene on to your children. If 2 people with sickle cell trait have a child, there is a 1 in 4 chance that the child will be born with sickle cell anemia, with the full blown. In the UK, all sickle cell disorders are most prevalent in people of African and Caribbean descent, as I said. If they were in like Asia or China, then they will be more prevalent in those countries, you know. And the life expectancy, according to Wikipedia, is 42 to 47 years of life. I've passed that, so I'm living on borrowed time according to them. Right, so the official statistics state that there are 250,000 people in the UK with the trait, and the official number of actual sickle cell warriors in the UK is 15,000, although it is believed by many health officials that the number is more likely to be like 30,000. Right, some symptoms and results. Right, the average sickle cell patient lives daily with full body pain. Right, this is the adult I'm speaking of. You know, also bouts of life-threatening sickle cell crisis. These can be, you know, like minor or major. Eating disorders, a prescription drug dependency, trauma and anxiety, memory failure, tooth and hair loss, ulcers, swollen joints, migraine, hearing and vision impairment and loss, depression, and has a morbid fear of impending death, which is quite natural if you're told at 4 years old that you'll be dead by the time you're 19. All right, so the average lifespan of the normal red blood cell is 120 days. However, the abnormal blood cells in the sickle cell patient aren't produced as quickly, aren't replaced as quickly, I should say, and on average, they only live for 20 days, so that's 100 days difference. Right, so normal red blood cells are flexible and disc-shaped, but in the case of sickle cell anemia, they become rigid and shaped like a crescent moon or a sickle, which is a farm tool and how it gets its name. The abnormal cells are devoid of oxygen, so we are encouraged to take oxygen, you know, and to eat oxygenated foods and stuff like that. And they're unable to move around as easily, you know. Sorry, I missed my place. And unable to move around as easily as normal blood shaped cells, and they block the blood vessels, resulting in tissue and organ damage, daily pain, lethargy, and episodes of severe pain, as I mentioned before, called a sickle cell crisis. A sickle cell crisis can last from a few minutes to several months, although on average, most last from around 14, you know, from 5 to 14 days. Right, so the average symptoms from childhood can include jaundice, which is usually how it's like recognized in the first place, severe joint pains, chest infections, anxiety attacks, headaches, strokes, tiredness or complete lack of energy, epistaxis, which is when the nose bleeds and it won't stop, all of a sudden, an unquenchable thirst, nocturnal and daytime enuresis, basically bedwetting to quite late in life, and sometimes wetting yourself whilst you're awake, not being able to manage your bladder, because in the case of the sickle cell warrior, the bladder is a bit smaller than average, and especially when you're encouraged to drink a lot of water, these accidents can happen. So there's breathlessness, consistency cold, and there's priapism, which is when the penis becomes swollen and lumpy, and this can last for hours or even weeks. Very painful. The patient has to be hospitalized, and it can cause impotency. Right, these symptoms, and sometimes including the conventional treatments, often manifest in ailments such as iron overload, because if you're taking blood transfusions and iron, your body's taking a lot of iron, so you'll need a medication for the iron overload. And again, migraines, gallstones, breathing difficulties, swollen removal of the spleen, reduced bone density, leg and stomach ulcers, blindness, pneumonia, weakened immune system, cartilage degeneration, which means, that's why many sickle cell warriors have like joint replacements, hip, shoulder and so forth, organ failure, and then there's slow or even sudden death. Right, some treatments. We'll start with conventional treatment. Most sickle cell patients are relying on the National Health Service for their treatment and may be totally dependent on the conventional treatment. I would say a sickle cell crisis can be triggered completely unexpectedly. However, it is also triggered by cold, damp, temperatures, change in temperature, stress, dehydration, infection, bruising, etc. I'll just ask Dr. Mark if he can mute. Then thank you. All right. Also, they're prescribed antibiotics daily because of infection, pain-relieving medications daily, vaccinations to prevent infections, and that can be monthly, annually, or whenever required, and also blood transfusions, and some patients take them monthly or whenever required. Also, then there's hydroxyurea, right? That's another strong medication. When taken daily, hydroxyurea reduces the frequency of painful crisis and might reduce the need for blood transfusions and hospitalizations. Hydroxyurea seems to work by stimulating production of the fetal hemoglobin, which is the type of blood that you find in newborn babies, that helps prevent the formulation of sickle cell. And hydroxyurea increases your risk of infections because it's like chemotherapy, whereas it strips your immune system, so there is some concern that long-term use of this drug might cause problems later on in life for people who take it for many years. There's more study is needed, in my opinion, and it's also ongoing whilst in use. Then we have like bone marrow or stem cell transplant. This is the only offer of a potential cure for sickle cell at this present moment, but it is reserved for only children under the age of 16 because the risks are increased for people older than 16 years of age, and it's not free on the National Health Service. Finding a donor is difficult and the procedure has serious risk. There's even been deaths on the operating theatre. Right, but in Sickle Cell Cause, we do promote healthy foods, a healthy lifestyle for our sickle cell warriors. I've managed to, I only had one blood transfusion in 2015, and that was caused because of a medical mishap when I was in hospital having an operation. Apart from that, I've managed to reduce the transfusions they used to give me throughout my childhood and throughout the years. I tried to, not to have to rely on blood transfusions, but I do know that there is a need, right? So we promote self-care and responsibility, and we say to try to manage your daily sickle cell symptoms, use heat treatments like hot water bottles, things like that. There's massage therapy, breathing exercises, and move your body, like daily stretching and walking, and yoga is also good. Eat foods with a high water content and include seeds and beans and nuts in your diet for your protein. You know, try to avoid meats, you know, dairy products and processed foods. And if you have to eat these, try to eat them minimally. Don't make them your main staple diet, you know, and drink lots of water throughout the day. Keep your mind active, right? And include supplements like zinc, L-arginine, omega-3, and vitamins C, D, and E. Right, I've got a picture of Frida Gacy, who was a sickle cell warrior and part of our organization. She is a raw food chef. She's also a natural health advisor. She's not had a sickle cell crisis in over 20 years, and she was a virtual student of Dr. Sabi, you know, and she advises us on all of our on our health holistically, you know, with our recipes and, you know, and tells us, you know, what we can do, how to help ourselves. So she's always available for support. Right, so now we come to the era of COVID-19 and the average effects on the sickle cell warrior. So all I can say is that we had a horrendous year of 2020. In comparison to our previous years as a group of mainly sickle cell affected, we have not been able to extend our hallmark hands-on approach of peer-to-peer support, like in A&E and like with hospital admissions, home care, childcare, outings and activities, etc. Everything's been online. And speaking personally as a warrior and also as the person who received calls and emails, and I've had 3 calls already today before this meeting from sickle cell warriors, and I'm talking about new people, not people that I'm accustomed to, you know, asking for advice, you know. I surmise that since 2020, around 98% of the warriors of sickle cell cause, as well as living with their normal painful daily sickle cell symptoms and their effects, now have increased fear of being alone. They have a fear of needing to be admitted into hospital for sickle cell, a fear of the constant array of new medical procedures and treatments, you know, that are being advised to take that were previously not prescribed and alien to the individual warrior. And now we have the big question of the big fee. You know, all of this seriously damaged heightened levels of stress has caused trauma anxiety, including from the number of sudden and questionable deaths within our sickle cell community during 2020. Right, so I have some information shared by the Sickle Cell Society, you know, from the National Data Collection, and this is from April 2020 to January 2021, from last month, right? So the 10 hemoglobinopathy coordinating centres across the UK collated their statistics under Dr. Mark Layton, and he's a senior physician under Hammersmith Hospital, and it states that during the first wave, which was the first wave of this COVID era, which was between February and August 2020, there was 250 affected sickle cell warriors across the UK. In the second wave, which was during September 2020 to January 2021, these numbers increased to 550 countrywide. Of this number, 47% were admitted, 13% needed to be fused with blood, you know, as well as the other medications and treatments they would have received. You know, 99% recovered and 1% died. These statistics were shared with encouragement for sickle cell warriors to take the vaccine. Sickle cell cause believe that isolation, lack of fresh air, stress, postponed and fearfully avoided medical attention are all an added cause to the heightened number of trauma anxiety cases needed specialist care that we've had to undertake. I'd like to introduce you to Professor Simon Dyson from the Montfort University, and he is a powerhouse of education. This is where we get our information from to share in schools, the workplace, you know, everywhere else. And he's written about racism with regards to sickle cell. If anybody wants any of these links online, you can have these documentations via e-link, so anybody can have them. He's written them for anybody and everybody. He shares the information. You know, he was a friend of Dr. Neville Clare, you know, and he visits our center, visits our sickle cell warriors and shares information. So I'd just like to have mentioned him. You know, sickle cell cause encourage additional peer-to-peer support and help and advice programs via education, including peer-to-peer support. So we are a grassroots peer-to-peer support community group, right? And our bonding includes talking therapy, healthy eating and nutrition, therapeutic beading and, you know, massage therapy, kinetic yoga, but also additionally, since this era of COVID, we've had to engage with the NHS, you know, for professional private counselling in order to be signposted to access other areas of treatment, like bereavement counselling. We're not equipped for that, you know. And then we've got a cleaning and professional packing service. You know, it's the trauma anxiety is heightened. I'd like to say thank you to the people that stay with us throughout the year, each year and every year, like Gift Genius African Heritage Wealth Empowerment Program, AGA Global Ambassadors, Our Legacy fundraising team. I have to shout out Miss B, I'm going to come to in a minute, Ebony Carr, Divine Feminine mobile, you know, fusion with the yoga sessions and the packing service, you know. But before I go, I'd just like to say that for many decades, it's been my personal view that because sickle cell is associated mainly with people of color, this is the main reason why it hasn't received half the amount of attention of other painful, debilitating, life-altering, and lifelong killer diseases. Therefore, it has been left to those that suffer and those that are associated and are supporters to this condition to lead the work within the realms of real peer-to-peer support, medical research and awareness. Even to this day, as I mentioned before, many qualified doctors receive no training on this condition during their time spent in medical school, and sadly only associated with sickle cell when they're faced with the patient in full-blown crisis. Right, because of this human rights travesty, I feel it is very important that it is noted and recognized in hospitals, clinics, and with general practitioners and with research that the adult sickle cell patient is the expert in the room. Is accustomed to living with his unique strain of the sickle cell disorder. Remember, there is 100 with 7 which are most common. My personal hope going forward is that I will witness a change in attitudes, and I strive to see the real cure for every person, which means policies in place to assist a complete halt with a manifestation of the sickle cell anemia gene. I'd like to finish up by saying, what can you do to help us? First of all, not everybody takes blood, but sickle cell is a blood condition. And I'd like to hail up Sister Tokwasi from the Blood and Transplant Center. She's a great sickle cell supporter and blood donor herself. You know, thank you very much. And I'd like to hail up Brenda Smith, Miss B. And I'd like to everybody to congratulate her because this month on the 15th is her birthday, and she will be giving her 40th blood donation. Her 40th, and she's a sickle cell supporter. She's a volunteer for Sickle Cell Cause and the Sickle Cell Society, and we are very, very honored, and we just thank you, because I don't even think you know the amount of lives you saved with the blood that you've given. Thank you. Right, so how can you help Sickle Cell Cause? Give blood, call Tokwasi 0300 123 2323. Get tested for sickle cell. You can go to your GP or the George Marsh Center, 0208 702 6630, and they will make an appointment for you to get tested to see if you carry that gene. You know, volunteer for Sickle Cell Cause. We're always needing volunteers. You know, right now we're working on minimal people, and it's very difficult. We've got heightened amount of cases and less people doing the work. You know, so we do need volunteers, and also use that email address if you yourself need support. And please donate to help the cause. We have a Barclays Bank account, 204657 303 484 PayPal. And please go on change.org and sign our petition to save our center. With that, I'd like to say thank you very much.
Wow, 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 sister. I can't believe it. Fantastic. If you can come off share screen, sis.
Okay, I'm trying to, right.
Absolutely fantastic, Samantha. Absolutely. I mean, I think there was a Karen in the chat room that said, excellent presentation. I can't love it. And I would like to touch about you now saying that you have to save your center. That's crazy. Brothers and sisters, time is limited. So if you would like to ask your question directly to the sister, please raise your hand. We've got over 600 people on the platform at the moment. So please raise your hand and we can really start. And please make sure your question is direct and to the point so that we can get as many people in the chat room. I know there's a lot of questions in the chat room. I'll try and get to that maybe sometime, but let's have a look. CJ, I know CJ's name was mentioned. CJ, can you unmute your mic, please, and ask your question or make your point, please? CJ. CJ? Okay. Empress Divine. Empress Divine, can you ask your question, please? Oh, wow.
Hi there. Hi, brother. I don't think they're able to unmute their mics for some reason.
Yeah, they should, because I've given them permission to talk. I'm not too sure why, but sometimes you get these technical situations.
I've got a question for the sister. Thank you very much for an amazing presentation. A question about the blood, giving blood, and it might be something that a lot of people in our community share. A lot of people in the community may have a fear of giving blood.
Yeah.
What do you say to that?
Yeah, we find, well, they do say, statistically, it's a fact that there's a lack with black blood donors, you know. But with sickle cell, with any blood, basically, it's best to have a match. It's matched with, your type. You know, if I'm to take European blood, I have to cross-match with different things, and these cause antibodies and so forth, and then you have to get treated for, things like that. So it's always best to have blood from your race, But the black community are the lowest blood donors, understandably. It could be fair from needles, fair from the medical profession, or people just don't believe in giving it or not giving it any thought. But all I say is that if you was to get licked down tomorrow, right? If you was to go into hospital and if you would take a blood transfusion, please donate blood. If you would take it, give it. That's all I'm,
Okay. Thank you, sis. We've got a few. Alfred Robinson, I believe that you can speak now.
Hello, can you hear me?
We can hear you loud and clear, King. Thank you very much, KRISTOS, for that question.
Excellent.
Yes, Alfred.
Okay, now I'm in Ghana at the moment, and my daughter's got sickle cell, and my lady has also got sickle cell. Now, what I found is in Ghana, they have a
Sorry, brother, you cut out just then, Alfred. Brother Alfred, are you still there, bro? All right, we try a few more. Alfred, if you can come back, let us know.
Bro, you could potentially make them a panelist just so they can ask their question and then return them back to attendees.
Okay, Kemi Woods.
Oh, hello, Samantha. Thank you for that presentation. I'm on the Solace group. I just wanted to ask about yoga and stretching for children. Is there any kind of service that you would recommend, or if YouTube or something? Because there's so much out there, and my daughter, she has suffered with lots of crisis in the last several months. She started having blood transfusions, but I didn't, and she was very active prior to about 2 years ago when she seemed to get more crisis. I don't know if it was to do with puberty, etc. So we want to keep her as active as possible. I think yoga and stretching is a great idea. Is there any platform?
Yes. Yeah. If you was
for children, she's 10.
Yeah. Our yoga instructor, she does some kinetic yoga, which is for children and adults. We've not really had a demand for children, but if you email us, sicklecellcalls@gmail.com, and make a request, and then if she can do it online for, one-on-one, as long as you're there to help your daughter, or even, but I don't know about outsourcing any service out there that, I know that we do it within our organization, but I can't recommend anybody out there. And
cool. That's fantastic. Thank you very much. Thank you.
Beautiful. Thank you for that, Bianca. Thank you very much. Oh, sorry, Kemi Woods. Kemi Woods. Okay, Sister Carol Andrews. Yes, there. Can you unmute your mic, please? Yes,
Yep.
there.
Just seen it now, thank you.
Oh.
Hiya. Thank you, Samantha, for that interesting presentation. What I'm wondering is, you know, when you said you can get tested for it, I have fibromyalgia. Can you have chronic fatigue syndrome? Can you have can it be linked, or should it have been picked up when I was younger? Because my sister passed away with SLE.
Okay. It's
Yeah.
a lot of medical terms, and as I said before, I'm not medically trained. I'm a sickle cell warrior, so I don't know these.
So you know,
is this anything to?
Yeah, so you know, like what you were mentioning, that's things that I do suffer with, lots of pain. I need heat syndrome treatment and things like that. But I'm just wondering, would it have been picked up when I was a child, or can you get sickle cell anytime?
Oh no, you're born with it. You're born with
Right.
it, and depending on the severity of it, you know, maybe it wasn't picked up, and depending where you're born, you know, whether they tested you as a child, you know. I was born a long time ago. They didn't test me as a child. It's something that I found out. But we've done a lot of campaigning over the years, and now they test every child that is born, especially if they're of African heritage or with an African name.
Yeah, so if I basically have a lot of pain and everything that you've said, I'm going to look into the diet as well. Would it be something that I need to maybe have a word with my GP over?
I think you should phone the George Marr Centre or your GP and ask to get tested to see whether you have the sickle cell trait, or even if you carry the full blown, because you may have a mild case of the full blown. You know, so get tested. That's what
Thank you so much.
You're welcome.
Just to add on quickly to that one, fibromyalgia, it is kind of a systemic condition which does affect all your joints, etc.
Yeah.
I think you would know by this point if you had some type of sickle cell which was affecting your life in any severe way. However, still check with your GP.
Yes.
And also, fibromyalgia is one of those conditions that are often ignored.
Yes,
so you have to be quite persistent.
Yeah, I've got CFS as well. So no, thank you so much. Thank you, Christoph.
Beautiful. Thank you very much for that, Sister Carol. Fantastic. Janetta Greaves. Janetta Greaves.
Hi, I'm here.
Fantastic, Janetta. Can you ask your question, please?
Yes. So Miss Greaves herself said that there's been a rise in cases of sickle cell outbreak, needing support medically, and she reached out to the community to ask for support. Now, with the numbers that have risen over the course of the pandemic of the need of support from people who do suffer from sickle cell, what kind of number is she looking at for the support in the community of those who are suffering from sickle cell? I hope that made sense.
It didn't. What I did say is that, like, since the pandemic, I'm receiving, like, sickle cell cores are receiving heightened numbers of sickle cell warriors asking for support, community support, like peer-to-peer support from, you know, other people with sickle cell to help them with, you know, their challenges, you know. So our workload has increased. You know, so we are looking for volunteers. If anybody's got any time or anything that they can, you know, volunteer some time to help us with our workload. And like, a lot of it is anxiety, bereavement, you know, helping with like packing things away. Like, people are lonely. You know, there's a lot of trauma. If you're interested in volunteering, we can send you a list of what the type of works that we need support with.
Right. So basically what I was saying is, what are the numbers of support staff are you looking for?
I don't know if I understand the question. Andrew, do you understand the question?
Not really, to be honest with you. But I think it's on the line of, she actually wants a figure of how many people do you want in terms of your support staff. I don't know if there is a figure.
Oh, no, there's no figure. The more the better. 100.
Yeah.
All right then.
you know.
Okay.
More the merrier.
All right then.
Yeah,
Well, you take it easy.
Janetta, thank you so much, my queen.
Thank you.
Thank you.
Jen.
Bye.
Bye. Take
Bye.
care. Okay, we're running slightly now, so I'm just going to allow 2 more people in to ask a question because. Sorry. There was a Sandra Anderson that I was going to bring in. I'm not too sure if she's gone now. Sister Sandra, could you unmute your mic, sister? Can we? Sister Sandra Anderson, you had your hand
Hi
up.
there. This is her daughter, Kane. So
Okay, I know you, Kane. How are you doing, sis?
good, thank you.
Evening, Andrew.
Good evening, Sandra. Fantastic.
Okay.
So my question is for Samantha. So thank you for the presentation. I just wanted to find out what your views was in regards to daily medication that's prescribed from the doctors, like penicillin V, and what your views were on like vaccinations and things like hydroxyurea, and if you ever felt the pressure to obviously take these daily, or if you do, if you believe in a balance between that and holistic. I just wanted to know your views because it's quite confusing and it's quite it's very overwhelming when you've got a lot of information being thrown at you and you don't really know what the right way to go is, and obviously everybody's different.
Yeah, I cannot advise anybody on what they should or should not do. You know, on a personal level, from like 2004, I started going a more holistic route. Like I was on 8 different prescription medications, right? And I cut that out and I started looking at nutrition and things like that. And since I started taking a more holistic route, I'm more healthier. I put on weight, in some cases too much weight. But the point is, I'm a lot healthier now as I'm older than I was when I was younger. So I do encourage a healthier lifestyle. And like, for instance, penicillin, I'm allergic to penicillin, so they give me a different antibiotic. They say I should take it every day, 3 times a day. Right? I'm at an age now, I'm not taking these things every day. I know when I feel that I need it, and then I'll put myself on the course of it, and then I'll take myself off. I'm not going to be reliant on these medications day in, day out. I have to live as normal as possible, or try to. And I think that Grand Creator provided us with our medicines growing from the ground, hanging off the trees, and we need to look more into that as well before we be so reliant on conventional medications.
Thank you so much, Samantha. You have been fantastic today. Brothers and sisters, please give up to Samantha. Just remember, brothers and sisters, later on we have got one of the most powerful doctors in the person of Dr. WALCOTT. He's going to be coming on. So regarding the medical questions as such, Dr. WALCOTT is here for that as well. And Samantha, you sound like a medical expert today anyway, to be honest with you, sister. You are absolutely fantastic. But the sister in her humility, states that she is like the grassroots, man. She's coming from the warrior stance and from someone who suffers from sickle cell and just had enough and stood up and said, you know what, we need to make this change. And so, sister, we thank you from the bottom of our hearts. We bow to you and we pray to you, sister. And I apologize.
Always a pleasure.
Yeah, and we apologize for anyone who was not able to ask questions. Don't forget, we've got questions and answers right the way through tonight. And if those of you that came on late today, remember that this program is being taped and it will be released tomorrow. So anything you've missed out in the past, it will be replayed again. Brother Leon, was there something that you wanted to say?
I just wanted to say that was amazing, sis.
Brilliant.
Absolutely, truly amazing. Truly amazing. You're getting all the feedback in the
fast in a long time. Okay, thank you so much. Thank you, guys. Thank you.
If you can read the comments, I'm sure they will inspire you, sister.